Hello and welcome. Today we're diving into a condition that affects not just hearing, but sometimes vision as well: large vestibular aqueduct syndrome, or LVAS. We'll explore what it is, what causes it, and what can be done about it. The exact cause of LVAS isn't fully understood, but it's generally believed to be primarily genetic. In many cases, it's linked to mutations in the cell C26A4 gene. This gene plays a critical role in the development and function of the inner ear. Other factors, potentially environmental, might also play a role in triggering or worsening the condition, but genetic predisposition is the strongest known factor. To understand LVAS, picture this: within the inner ear, there's a bony channel called the vestibular aqueduct. It houses the endolymphatic duct and sac, which are important for regulating inner ear fluid balance. In LVAS, this aqueduct is abnormally enlarged. This enlargement is thought to disrupt the fluid balance within the inner ear, leading to fluctuations in pressure and, ultimately, hearing loss and sometimes balance problems. This fluid imbalance may also, in rare cases, exert pressure on or affect nearby structures including nerves, leading to vision-related symptoms. LVAS is relatively rare, but it's one of the most common identifiable causes of congenital hearing loss, especially in children. While precise statistics vary, studies suggest it accounts for a notable percentage of individuals with sensorineural hearing loss, particularly those who experience progressive or fluctuating hearing loss. It's important to remember that, because it's often detected during childhood hearing screenings, its prevalence in adults is less known, although it can certainly persist or be diagnosed later in life. The most common sign of LVAS is hearing loss, often fluctuating or progressive. This means hearing can worsen over time or vary from day to day. Some individuals may also experience vertigo or balance problems. Less commonly, LVAS can be associated with visual disturbances, such as blurred vision, double vision diplopia, or nystagmus, involuntary eye movements. It's vital to remember that the presence and severity of these symptoms can differ significantly from person to person. Diagnosing LVAS typically involves a combination of hearing tests, balance assessments, and imaging studies. An audiogram, a standard hearing test, can reveal the degree and type of hearing loss. Vestibular testing assesses balance function. However, the definitive diagnosis usually relies on imaging, specifically a CT scan or MRI of the inner ear, to visualize the size of the vestibular aqueduct. If the aqueduct is significantly larger than normal, it confirms the diagnosis of LVAS. While LVAS itself isn't generally classified into distinct types, the presentation of the condition can vary significantly. Some individuals may primarily experience hearing loss, while others may have more pronounced balance problems. The degree of hearing loss can also range from mild to profound. These variations depend on the individual's genetic makeup, other potential contributing factors, and the severity of the aqueduct enlargement. Currently, there's no cure for LVAS. Treatment focuses on managing symptoms and preventing further hearing loss. This often involves using hearing aids or cochlear implants to address hearing impairment. Strategies for managing vertigo, such as vestibular rehabilitation therapy, may also be recommended. Crucially, individuals with LVAS should avoid activities that could cause head trauma, as this can potentially worsen hearing loss. Regular monitoring by an audiologist is essential to track hearing changes and adjust treatment as needed. Since LVAS is primarily a genetic condition, there's no guaranteed way to prevent it. However, genetic counseling can be valuable for families with a history of hearing loss or known SLC64 mutations. This can help them understand the risks of having a child with LVAS and explore available options. Avoiding head trauma is also crucial for individuals already diagnosed with LVAS to help preserve their hearing. The prognosis for individuals with LVAS varies. While hearing loss is often progressive, early diagnosis and intervention can help maximize hearing potential and quality of life. Cochlear implants can be highly effective in restoring hearing in those with severe or profound hearing loss. Research is ongoing to explore new therapies for LVAS, including potential gene therapies aimed at correcting the underlying genetic defect. Further investigation is also focused on understanding the rare instances of vision-related problems and how to effectively manage them. These advancements offer hope for improved outcomes for individuals living with LVAS.